It is Wednesday, and every Wednesday at this time we focus on matters your health. And today we're all about healthcare devolution. Is it time? Are the counties ready to handle such an important sector in the country, in the society? We are now joined by two gentlemen, Dr. Sultani Matendechere, who's KMPDU Secretary General, that is the Kenya Medical Practitioners, Pharmacists and Dentist Union Secretary General. Also joining us in studio this morning is Dr. Elly Nyaim, who's chair of the Kenya Medical Association. Gentlemen, thank you for joining us for your health. And you're really the people at the heart of our health. And as far as just seeing that everything is working right. So this devolution of healthcare, you have concerns about the same. What are your concerns? I'll start with you, Dr. Elly.
I must start by saying that health is a very important sector in terms of the socio-economic development of a country. And we cannot move when you're not sure. Okay, Constitution was passed in 2010 and devolution will have to happen, but you must really structure it, because there are certain areas that you must address in health, which we are not seeing people talking about. And when I talk about this, I'll for example mention the issue of training. We will need to keep on training health workers. We only have institutions at the national level. And then after you train these people, deployment is another issue. And beyond deployment, there's the issue of career progression, which has to be addressed very well. And then there's a big issue of infrastructure. As we speak now, there's such inequitable distribution of infrastructure in this country. So if it is not coordinated well from the national level, then we are going to get into a lot of problems. Not to mention that it's now public knowledge that a lot of counties have actually reduced their health budget significantly. So it appears like they don't think that health is a priority. And that's why we're really concerned.
What about you, sir?
Okay, first of all, I'd like to say that healthcare in itself has very many components. And as a union, we support devolution of healthcare because it has a lot of advantages. However, we are saying that we need to carefully identify which aspects we are devolving and at what time. So it is in the manner that we are devolving healthcare where the secret lies. If we are just going to say that we want to devolve everything at once, then we are actually going to achieve a situation that is going to grind the whole sector to a halt. But if we devolve it properly, taking into cognizance the fact that some functions have to be done slowly, we have to build capacity for them to be handled by the counties, then we are going to have a very well devolved healthcare system where the counties handle some aspects of healthcare and the national government handles some other aspects of healthcare.
As we speak, what is currently the situation? Has everything just been thrown out to the counties, now you deal, or is there that progression as you say it should be?
Okay, unfortunately, we are even having an unconstitutional and illegal process that is already underway. Because you'll realize that on the 9th of August, there was a gazette notice that gave a blanket transfer of all health functions to the counties. Now, this was in the absence of a national policy on health. It was in the absence of a functional law, a health law that is supposed to guide the implementation of devolution. And that is where all the problems lie, because no due regard was given to the fact that some counties might become ready to handle some functions before others. So even the counties which were in a very bad shape in terms of taking up functions were given those functions. And we are seeing a situation where, whereas the Constitution provides for reversal of functions, in healthcare we cannot go that way. Because by the time healthcare provision collapses in the county, and then we say now we want to reverse to the national government, people will already have suffered, people will already have died. So what we are saying is that for healthcare, let's do it differently. Let's not experiment so that it fails before we reverse. Let us do it in a way that we are sure that we are devolving it in a safe manner and people are not going to be hurt.
And if, as you say, Dr. Sultani, that this was unconstitutional, it should have happened the way it did, Dr. Elly, what has you done as the people at the heart of this? You understand the consequences, you understand the repercussions and what will happen, but have you sought legal recourse?
Usually, I want to believe that the legal recourse probably comes at the last thing, because there are a lot of steps in terms of engagement.
Okay.
And even what we are doing now here is part of that engagement. And I'm sure you are aware that particularly my colleague here has been quite in the forefront in expressing some of the things that we are worried about. And it's not just expressing, we are also engaging the stakeholders and the government authorities, so to speak, in the hope that they're going to see that there are issues that are happening here, so that we avoid going that legal, because legal direction sometimes also takes quite a while. And like we said, health sector, we cannot put it to a halt so that we finish this legal issues. It has to continue functioning. The service has to be delivered all the time. Yeah, but like my colleague says very clearly, this is one sector that requires very structured engagement, so that we're very sure what is the roadmap, what do we want to devolve at this point. Because ultimately, like I said, we probably take us many years to be able to train health workers at every county, because of the amount of investment that you require to put in here. So, of necessity, the universities and the Kenya medical training colleges that we have here will still have to produce workers for the whole nation.
Okay.
And so you must decide that who controls this thing, and when they come out, who deploys them. If they want to grow into their career, if you get posted to county A and they decide they don't care about whether you progress or not, and they keep there, what happens?
Yeah.
Yes. So those are the issues that we're talking about. It has to be very clear. This is where we want to start, this is where we want to go, so that eventually we enable and empower each county to be at a certain minimum standard in terms of healthcare provision.
Yeah.
Yes.
And it's important you say to be at a minimum standard in terms of healthcare provision, because as you also mentioned, 30 counties slashed their healthcare budgets.
Yes.
That's worrying. Of course, this is the health of the people. So what engagement, what do you see happening in terms of just the Ministry of Health, the stakeholders? Is it a lack of understanding, or is it an optimism that, hey, we have this thing that everybody's excited about called devolution, that everybody, you know, to is his own and to working out their problems and making sure they work out? Or what exactly is that disconnect? That, because I mean, these are other people who understand the issues and the challenges the health sector faces. So what is that disconnect that causes there to be that blanket devolvement and not taking the necessary steps?
My view is that there's a bit of excitement that now we have our own, it's our county. So, and you know, there's this expression that some of these leaders of this county are looking at themselves as mini presidents and all that. So we want to do it our way.
Yes.
That excitement is what is going to confuse us. And that's why it's very important that the policy level should still be directed from the national, from the center. So there is this policy that pushes and gives direction as to what the county can do. And it has to be very clear even to the governors and the senators and all those people that this is the minimum that we want for each county as we go forward. Yes.
Sultani.
Yes.
Okay, I believe that the problem is looking at devolution in terms of the money that comes with the devolution of functions, so that the officers at the county want to get as much money as possible. However, there is still this disconnect in terms of understanding that these functions, when they are given to you, nobody else is going to provide them. I think there's still a belief that even if we get the money and then we don't provide, there's going to be a way in which the national government will provide. We are already experiencing that in terms of salaries, because the salaries were sent to the counties in June. And there's an arrangement that was made, because by that time the counties were not able to run a payroll. The Ministry of Health took up that role of paying the salaries, with an understanding that the counties will pay back the money that has been paid. To date, only 4 counties have been able to reimburse that money, because once they got it, they channeled it into something else. And the governors have blatantly said that the ministry has been paying, so let them continue paying because they have money. Now, we are having some issues that we are raising, and unfortunately they are being politicized. Things like human resources for health, those ones have to be coordinated at national level, because you know, of course we are grappling with scarcity of health professionals, and we might find situations where some counties need professionals very fast, and we need to move them from one county to another, and maybe maybe from a county to the national level or national level to county. Now that one cannot be done if we have blanket transfer of health professionals and we have locked them within the county.
Right.
We are going to cause a crisis. Things like regulation. The drugs that we are using, they need to be regulated, and it is a very cost-intensive process which cannot be handled at county level. So before we build those structures, we need to maintain regulation at national level so that we are sure that the drugs that we are exposing our people to are helping them. Remember, there is even a global alert on counterfeit drugs, which are being targeted for third world markets. They are being sold cheaply. These are drugs which either do not have even the active ingredients. These are drugs which probably have dangerous components inside. And we are facing the danger of our people being given those drugs by the governors who want to make savings as their most important issue, as opposed to ensuring that the things that they are giving to the patients are safe. Yeah, so those are some of just part of the issues. There are many others that we are looking at which we need to contain as a nation. There we are already receiving cases of tribalism in the counties where health managers are being fired. Yeah, county directors of health are being sent back, and then someone who has just come out of school, because he's a native of that county, is now charged with very delicate roles of administration just because they are natives of that county. And you see, these are people who, much as we respect that they are professionals, they might not have gotten the managerial experience that they need. So where are we heading as a health sector? So those are the issues that we are trying to raise.
So the county is approaching it from a very uninformed, very, as you're saying, a place of just, now that we're excited about this devolution, let's do it the way we know best. I mean, to go to that extent of just getting somebody because they're from the region and not necessarily because they're employed, or rather they have the experience, is really worrying when you're talking matters health. But as a country, where do we stand? He's mentioned something about the service providers, the professionals, that is. We've always known the number of doctor to the people they must attend to in a country, the statistics. How are we looking?
We're not looking very good. And you know, I want to say that we've got cadres. If we take doctors, for example, we've got the basic people who are the medical officers. And if you look at it very globally at that ratio, I think Kenya, we are doing one doctor to 12,000 per population. If you look at the general population, it will vary from county to county. Probably Nairobi is a better ratio. If you go outside the cities, maybe it's a bigger ratio. The World Health Organization recommends 1 to 3,500 doctors. So you can see the gap that you're still having there. If you go to the nurses, I mean, it's common knowledge now that we have a shortage of more than 100,000 nurses who need to be deployed in this country. And that goes across all the cadres. It gets even worse now when you come to specialists, the surgeons, the gynecologists, and so on and so forth. In fact, there's some specialities, like these people who treat cancers. There are actually less than 10 in this country for the entire population of 40 million. So if it so happens that you devolve in a blanket manner, and all the 10 happen to be in Nairobi, then what happens? What happens to the other counties? And so that's why the human resource, like you said, and that's why I kept on saying training and deployment and career progression. Those are things that must be managed very effectively from the national level, so that we get some equitable distribution of these resources that are very important.
But also one of the issues that has really just been there in the health sector is the brain drain, if I may call it that way, where you're getting all these professionals, but they go outside to practice. Why? Because at the end of the day, first the pay, you've raised that issue, but also the infrastructure, so that if I'm going to go to Wajir, you know, if I'm going to go to Turkana, to Mombasa, to Kitui, whatever, Machakos, whichever part of the country, that I know there are facilities there. And these are things that don't happen overnight, right? In terms of just putting up those infrastructures. So it is something that will take quite a while to work this out, to make it work wholesomely. But what do you think is important and key, right from the top, the government and the stakeholders, Ministry of Health, yourselves, everyone involved, to keep in mind at this early stages we are getting to this devolution?
Okay, I think you've even already said it in quite a number of words. What we have been lacking in the health sector is stakeholder involvement, so that you find the most of the decisions that have been made so far have been skewed towards only one form of stakeholders, or a very minimum number of stakeholders. Since we started raising these issues up, you will realize that we have even, right now we have given a strike notice, and probably, most likely on Tuesday, all the health workers will be proceeding on strike.
You'll be striking over?
Over this disorderly devolution process.
Yes.
Now, what we are seeing now, and I really want to bring this out, is that even yesterday, we had a very fruitful meeting with the ministry officials, and we discovered that there were so many gaps which we would not have had if we'd just have engaged at the right time. So, and we are seeing a situation where we are in a very delicate sector. We should not even by law be going on strike, but we have been pushed to the wall such that now we are going to engage in such things which are going to hurt people, and yet we would just have sorted them out. So probably moving forward, and especially at this time, because I usually believe that it is never too late. If we can have the same spirit, because the president asked us to engage with the governors, if we can have the same spirit, resolve this crisis that is impending right now, and then moving forward, we maintain involvement so that we can be able to address the issues of all stakeholders across board. I usually want to put it this way. In the health sector, we have very many stakeholders, but there are three key stakeholders. The most important is the patient. So the patient's voice must be heard in these deliberations of devolution. Another very important stakeholder is the health worker, because the health worker is the implementer. Without the health worker, we don't have health care. So they also must be heard. The other stakeholder is the government, because the government is the one that provides the resources, the hospitals, and so on. So instead of usurping all the roles, the government also has to bring in the voice of the patient and the health worker. Then we have also other stakeholders like media, the NGOs, and so on, and even the other people who are neither patients nor health workers, the healthy Kenyans. So we also have to get the voice of all these people so that we can put all those issues together, and then we devolve the sector in a safe and proper manner.
Finally, Dr. Elly, you say that this ultimately will push you to a strike to at least see that something is done at the end of the day, which also is not the best solution, but you feel that is what it has resulted to, as you give your closing remarks as well?
Like he says very well, there's need for a lot of consultation and engagement, which hasn't happened. And so sometimes people sit at the top there and they assume that they know. And in fact, they come and they want to push it down your throat and tell you we have decided it has to happen this way. Well, as people who are important stakeholders in that sector, there are certain things that you're seeing that are going to make us go the wrong direction. And we just want to be heard so that this can be considered. And unfortunately, in world over, usually when you're not listened to, even in your own house, your child will do outrageous things just for you to take notice. So like he says, this is a last resort. But it's not too late. So it's still possible that we can engage, put certain things on hold so that we are sure that we're moving forward in the right way.
Thank you very much, sir. Dr. Sultani Matendechere, KMPDU Secretary General, and Dr. Elly Nyaim, Chair, Kenya Medical Association. Thank you both for joining us this morning on the show, and of course just highlighting some of those issues. Very important, as you kept saying, delicate sector. It is indeed the health sector in the country, and we hope it doesn't have to end into a strike, because that again will ultimately hurt everybody. But as we've heard from the gentlemen, key gaps in as far as that conversation around devolution of healthcare is concerned, and this we hope all the stakeholders can resolve as soon as possible for the sake of ordinary mwananchi.